So today we will be talking about renal agenesis, multicystic dysplastic kidney, and duplex collecting system, and hydronephrosis. I mean fetal hydronephrosis. So we are having this ureteric bud, and around ureteric bud we are having this mesoderm, which is called metanephric vesicle. It can also be called blastema or metanephric mesoderm. This is ureteric bud. Okay, now for the development of the kidney, this ureteric bud must come in contact with metanephric vesicle. Okay, when it come in contact with the metanephric vesicle, then it will form kidney and ureter. Now, if this ureteric bud fail to develop, okay, and if it fail to develop, or if it doesn't come in contact with metanephric vesicle, okay, to induce metanephric vesicle development, then both of these conditions will lead to renal agenesis. Renal mean kidney, a mean without, and genesis mean organ. So there will be complete absence of kidney. Okay, no kidney or complete absence of kidney. If this ureteric bud does not induce metanephric vesicle or metanephric mesoderm to develop, then it will cause multicystic kidney disease. Okay, the kidney will be consisting of multiple cysts, and the kidney is going to be non-functional kidney. Okay, and the kidney is going to be consisting of many cysts plus connective tissue. Now the multicystic kidney can be involve only one kidney, which is called unilateral, but if it involve both kidney, that will be called bilateral. Now bilateral will lead to no urine formation. If there is no urine formation, it is called oligohydramnios. Oligohydramnios means that there is decrease in amniotic fluid. Okay, as urine are going to form amniotic fluid. Oligohydramnios, there is no urine formations. It means there is decrease in amniotic fluid. Okay, this is, you guys can see now, the two ureter will get enter into metanephric vesicle. These two ureters are called double ureter, or it can also be called duplex collecting system. Okay, two collecting system or two ureter, and its shape is like Y, so it is also called Y shape bifid ureter. Okay, now this is one ureter. Now if it divide into two ureter, then there will be the chances for obstruction will be increased, and there will be increased chances for infections. Okay, risk of infection will increase. The ureteric bud at first time it is in solid. Okay, but later on then canalization started in it. Okay, then it start canalizing, and this is, you can see, solid ureteric bud. Okay, and that is canalized ureteric bud. Now the canalizations of ureteric bud is completed at around 8 to 10 weeks, but you guys just remember it completed at 10 weeks. Now the last part of the ureteric bud to canalize is ureteropelvic junction. Okay, now this ureteropelvic junction is the most common site for obstruction, and if it is obstructed, okay, then its obstruction will cause fetal hydronephrosis. Okay, hydronephrosis. Now let's me draw the diagram. This is ureter, this is junction, and this is pelvis. Okay, and okay, now this junction is ureteropelvic junction between ureter and pelvis, renal pelvis. Now if it is obstructed, then urine will be collected in the kidney, and it will be increased, which can lead to kidney swelling, and this kidney swelling is called hydronephrosis or fetal hydronephrosis. Okay, Primi Gravida in her 18th week of pregnancy come to your office for a routine prenatal examination. Her pregnancy has thus far been unremarkable, and the patient has no medical problems, and her only medication is prenatal vitamins. Fetal ultrasound screening is performed during her visit, and reveals fetal hydronephrosis. Okay, so here we are talking about the fetal hydronephrosis. Okay, now you guys can see what they are going to ask now. The obstruction is most likely located at, okay, renal renal calyces like major and minor calyces, ureter, vesico-ureteral junctions, and ureteropelvic junction and urethra. Okay, so as I already explained you guys that first of all this ureteric bud is solid, and then the canalization occur in this ureteric bud, and the canalization is completed at 10 week of gestation. Now the ureteric bud give us collecting ducts, major and minor calyces, renal pelvis and ureter. All these will canalize first, but this junction which is present between the renal pelvis and ureter, this is called ureteropelvic junction. This is the area which is lastly is going to be canalized. So if canalization doesn't occur at this area, and so this area is the most common area for obstruction, and if the obstruction is occur at this area, the urine will be collected in the kidney, and the kidney will swell up, and that is called hydronephrosis. Okay, so our answer will be our answer is going to be ureteropelvic junction. Okay, so the correct answer is D. If a toxic insult occur during the early development of fetus and selectively damage to the metanephric mesoderm occur, which of the following will fail to develop? Okay, so they are talking about the metanephric mesoderm, or which can also be called metanephric vesicle, which can also be called blastema. Okay, and so we have to know that what are the derivatives of metanephric mesoderm. So the derivatives of metanephric mesoderms is nephron, Bowman capsule, okay, proximal convoluted tubule, distal convoluted tubule, loop of Henle, and collecting tubules. Now let's find the answer. Okay, distal convoluted tubules, okay, collecting ducts, minor and major calyces, and renal pelvises. Which one of the part of the nephron is here? That is distal convoluted tubules. Okay, so the answer will be most probably A. Okay, so this is A, and here you can see, as I said, this is the okay, this is the ureteric bud, and around this ureteric bud we will be having a mesoderm that is called metanephric vesicle or metanephric mesoderm. Okay, and the ureteric bud give us collecting ducts, minor and major calyces, renal pelvis, and ureter. And the metanephric vesicles or blastema, or the metanephric mesoderms, is going to give us the nephron, Bowman capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting tubules. So how you will differentiate between the collecting ducts and collecting tubules? Just remember, the tubules is going to be come with this nephron, like the metanephric vesicle. Like you can see proximal convoluted tubules, distal convoluted tubules, and collecting tubules. Okay, this is how you will remember it.